Hello everyone. Today we are going to learn about dental caries, one of the most important topic of oral pathology. It can come as SAQ, LAQ, anything, as well as it is very important topic for you as a dentist to understand what is dental caries, because that's something you are going to deal in a clinic as well. So you have to know this dental caries in very detail. I'm going to divide this dental caries topic into many different small videos, so it's become easier for you to watch. This is a part 1 of it. So let's start now. So first, let's see what is dental caries. So first of all, we have to know what is the definition, basic definition of dental caries. So according to the Schaeffer's, dental caries is defined as dental caries is a microbial disease of the calcified tissues of the teeth characterized by demineralization of the inorganic portion and destruction of the organic substances of the tooth. So what is this definition is saying is that dental caries is the one of the microbial disease. It is a microbial disease of the calcified tissue. What happened in this? There is a demineralization of the inorganic portion and destruction of the organic portion. Demineralization of the inorganic portion of the tooth and destruction of the organic substances of the tooth. Demineralization of enamel and destruction of organic portion, that is our dentine. So this was the Schaeffer's definition. Now see what is WHO's definition. It is a localized post-eruptive pathologic process of the external origin involving softening of the hard tissue and proceeding to formation of the cavity. It is also saying the same thing. It is saying that it is a eruptive pathological process in which there is a softening of the hard tissue, that is our enamel and dentine, and proceed to formation of cavity. So now let us see what are the different classification of caries. So first of all, the student based classification is according to the location, according to the extent, according to the rate of progression. Now let us see each of them one by one. So according to the location, it is classified as primary caries, caries of pit and fissure origin, caries of enamel smooth surface caries, backward caries, forward caries, residual caries, root surface caries, and lastly the secondary caries, that is our recurrent caries. So we will going to see each of these caries one by one in a detail in later videos. So next, moving forward to according to the extent. So when we talk about classification according to the extent, it can be classified as incipient caries, cavitated caries. Incipient caries is also called as reversible caries because it is in that state of caries progression in which it can reverse back to normal tissue. While cavitated caries are irreversible caries, they cannot be reversed back to normal tooth structure. Now the third classification is according to rate of progression. So when we talk about rate of progression, it can be acute or the rampant, that is it progress very faster. While second is a chronic caries, that is a slow or arrested caries, it progress very slowly. So these are according to the rate of progression. So here our classification has done. These are the different classification.